thinned out donor area, so much thinning of hairs at the back that the patient may be having hair growth in the front post hair transplant, but at the back, at the donor area where it should look nice and regular, there are patches of scars seen, which could be FUE scars or FUT scar. Line is visibly seen such that the patient now is feeling bad about the donor area instead of recipient area. This is a case scenario in the present times. And the magnitude of this problem, I tell you, is so much that in every OPD, we get 1 or 2 of such patients who are worried not about their front, but about their back. They want to tell us that, doctor, please do something about my donor area. It looks ugly, it looks bad, people comment about it. What should I do about it? My name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon. Today, we would be talking about the thinning at the back of your donor area, the magnitude of this problem, the cause of this problem, and what can be done for this. Also, we would be seeing some before-after cases of this problem so that you get a confidence that this can be treated. Do subscribe to our channel for more such informative and useful videos. Let us first consider why this problem is there. So you see, there are a lot of clinics now. There is actually a mushrooming of clinics which are doing FUE. That is done by any machine. Sometimes they are not considerate which machine they are using. They are using high rotation machine which creates a lot of energy. So it damages not only the graft but also the surrounding tissue. So what happens? The graft which is taken does not grow well and it also damages the surrounding area. So the area damage is much more than what should be there. Also, if they do FUE, they may be doing once or twice or even thrice without considering how many grafts should actually be taken from the donor area, which can be calculated by a good trichoscopic method, which we always do in our clinic so that we get a fair idea how many grafts you have at the back and at the maximum how many we can harvest. Also, if somebody is doing FUT, if they do a broad strip broader than 2 centimeters or even sometimes 2.5 centimeters and they do not do a proper trichophytic closure, which is a specialized technique so that the hair grows from the scalp, then in due course of time, the patient may end up having a wide, ugly looking scar. If this is the problem, then these thinned out areas need to be tackled. For such problems, you need to come to well qualified, experienced doctor and we will discuss your case in these scenarios. If you have any problem like this, you can always write in the comment section below. We would be happy to help. Let us now discuss the management of this problem. What can be done so that this problem can be tackled? The first thing which comes to mind, if only I could put grafts of hairs in these scars so that there is no scarring seen. But then it is very important to consider that you already do not have grafts. Whatever grafts you had, you already have put on the front of the recipient area. So here we would like to put scalp micropigmentation dots, which are very nicely put in the scarred areas, which give us a view that small hair follicle is coming out of it. So in these cases, when we put these scalp micropigmentation dots in all the scanned areas, whether it is FUE scar or it is FUT scar, it does not change the scar, but it gives a view that a hair follicle may be growing out of it. So if you keep your hair a bit longer and you get the SMP done, then in many cases this is very visually appealing, and sometimes when we see the patient and we do the SMP, we also say that you can now keep your hair shaved so that all the area looks similar. So it differs from patient to patient. After we do the scalp micropigmentation, we will tell you the length of the hair you have to keep at the donor area so that the result looks best. This is the maximum we can do and it is the best which can be done, and in many of the cases, it is perfectly alright to have scalp micropigmentation done after this problem arises, after your over-harvested FUE or a broad, ugly-looking FUT scar. If you have any problem like this, you can always call us on the numbers below and we can have a consultation with you. I would like to tell you here 2 very important points before you actually undergo SMP for your donor area. Number 1 is the ink which is used by the clinic should be a carbon-based ink so that whenever whenever it gets fade, it fades to the shade of grey. It doesn't change its color because of sun or after a due course of time. Number 2 very important point is a term called failed SMP. We have had patients who got their SMP done at the donor area by some tattoo machine, putting some ugly looking, very thick, broad dots around their follicle and their scars. That looked even more uglier than the scars themselves. So what we had to do, we had to firstly remove those dots by the laser machine which we have, the Q-switch laser. And after 2 or 3 sessions of tattoo removal from their scalp, we had to do a fresh SMP with finer dots about the size of the follicles themselves, of the density which looks absolutely stunning, very nice, according to the distance between the follicles, the appearance of the dots looking just like the follicles. So always consider and talk with the clinic, the machine they are using, the ink they are using, and please ask for a few of their results if they have any. So you can even consider which of the methods, FUE or FUT, is better in terms of harvesting of the grafts. So in order to have a better understanding and in order to help in your thinking and finding out which is better, do click on the link above in the video above so that you know it better. Let us now see before and after pictures of our patients who got this procedure done with us. You will also see a few videos of how we were doing it for them. After you see these results, I'll be showing you a major problem which is sometimes seen by some patients, which we tackled later on. So sometimes when a patient arrives to us with the problem of over-harvested FUE or FUT scar also, when we look at the front, we find the hairline is made as if with a ruler, with a scale, a very regular hairline, and that too thick-haired grafts, triple and double-haired grafts in the front. It gives a very weird look to the patient because in normal people, you always have a soft hairline having single-haired and very soft hairs in the front rows of any person on the scalp. So when this happens, we not only have to do SMP at the back, but we also have to soften the hairline, remove the extra grafts, and sometimes do a little more tweaking in the form of a little revised hair transplant in the front so that the patient gets overall holistic good result. Please subscribe and share this video to your friends and family so that they also get benefit with the valued instructions given here. To know 5 reasons why hair transplant fail, click the video on the left.